Hey, welcome back again. So in this segment, I want to talk about a technique I really like. It's the classic push and plug technique. And more specifically, I want to explain how I personally form the plug. Once my microcatheter is in position and I'm satisfied with where it's sitting, I begin my Onyx injection. Now, at the start, a little bit of Onyx penetrates into the nidus. It goes in just enough to start raising the resistance in that pathway, and as that resistance builds, that's when the reflux begins, because the onyx can't go forward easily anymore, so it starts pushing back around the catheter, and that's exactly where I want to be. So I let it reflux a little bit, just a short segment, and I don't wait too long, maybe just a few seconds. Then I reset my blank roadmap and I re-inject. And when I do, I usually see the onyx layering inside that previously refluxed segment. It's smooth, it's controlled. I stop again, just a short pause, reset the blank roadmap, re-inject, repeat the cycle. And I don't wait too long between cycles, just a few seconds each time. Now, after repeating this a few times, eventually I'll notice that the onyx stops layering and the reflux starts increasing in length. That's my signal to stop. Right then, I set the timer on the angio machine and I wait exactly 2 minutes. And here's what's interesting. In most cases, not every time, but most, after those 2 minutes when I re-inject, the onyx starts to penetrate beautifully into the nidus. It's like that little bit of waiting helped everything settle. And now the path forward is open again. That's how I do the classic push and plug technique. Now, let's talk about something critical: microcatheter entrapment. We really don't want that, because if the onyx refluxes too far and hardens around your catheter, you may have to cut it or leave it behind. That's the reality. So whenever possible, I use a detachable tip microcatheter. That's the way to go. With the detachable tip, you can control your onyx reflux with precision. The key is your reflux should stay between the two markers. That's the safe zone. It doesn't mean you have to hit both markers. No, it just needs to stay somewhere between them. And as long as your reflux is within that zone, you can inject as long as you want. There's nothing trapping me. If I ever need to stop, I just detach and walk away clean. That's the beauty of the detachable tip. It gives you confidence, control, and an easy exit. So that's the push and plug technique. Not just in theory, but exactly how I do it in practice. In the next segment, we'll talk about advanced techniques, things like pressure cooker, transvenous approaches, balloon-assisted injections, and some imaging tricks to make your embolization smarter and safer. Catch you there.